Hey everybody, this is Jeffrey Munson, and we are here today with Dr. William Clearfield at the Clearfield Medical Group in Reno, Nevada. And he wants us to call him Dr. Bill, but when you look him up, it's going to be under William, Dr. William. So, we've been talking about we've had the thread lift, Botox.
Non-surgical facial rejuvenation.
Non-surgical facial rejuvenation. That's what we've been talking
Now,
about.
if you could say that, in one sentence, your mother would be so proud.
Non-surgical rejuvenation.
Facial rejuvenation.
Facial rejuvenation.
Because remember, we did the third MIPA, which was for vaginal rejuvenation.
That's right. Yes, that was.
You're still turning red.
So, I think it's great. And we talked about the Y lift.
We did talk about the Y lift.
And which is an awesome procedure.
And
so
there's the old standbys. There's Botox, and there's the threads.
Filler.
Remember we talked about the threads.
Yes.
Well, we're using our Y lift technique for the fillers.
Okay. So putting it all together. I mean, so does somebody just come in for one specific thing? I mean, you only do one thing, or do you do?
Well, some folks do, but some people say, well, you're the expert. What do you see?
Okay.
And we really like to combine these. We get much more bang for our what we're trying to do when we combine these techniques, and they really look good together.
Oh, okay.
So on average, if we have you see Jeffrey's worry lines here, this is where we're going to take care of it. This is what we're going to take care of with Botox.
Okay.
And so Botox is a neuromodulator. It actually, what it does is it actually makes the nerves that innervate the muscles not work. So your muscles are here, but you can't frown.
Okay.
It makes them not that. Doesn't hurt. It feels normal.
Right.
You just can't frown.
Okay.
Okay.
So Botox here.
Botox for here, and all the lines that go across. That's kind of a rule of thumb. The lines that go across is Botox. The rest of the sagging part, or gravity,
do people do Botox down here?
We do some Botox.
Oh,
so we'll do Botox on the crow's eyes here.
Okay.
Squint for me. Show us. Yeah. See here. We'll do a little bit under the eye, even just to smooth that line out. Okay. We can do the upper lip, especially if you were a smoker. We've got those smokers' lips.
Oh, okay.
And for some of our more mature women who have had some estrogen deficiency after going through the change.
Okay.
Okay. Especially on the upper lips. We'll even do the neck, but we have some better techniques for the neck now.
Okay.
Too. Okay. So we'll even do the neck and even the chin. We can do Botox there.
Oh, okay.
Okay.
Huh.
So that will smooth out. So you won't be able to get that kind of.
Okay.
Okay.
All right.
Okay. So that's for up here. For the middle of the face, we like to use really a combination. So we have our Y lift. So our Y lift is our deeply placed fillers. And
the Y lift sounds like it's the thing.
Yeah.
Yeah.
So yes. Yeah. So along the bone. So we have the bones here. Bone here. It's called the zygoma, by the way.
Zygoma.
Okay. You can use that in your next class.
All right.
Along the bones along here, we're going to use Voluma, which is a product made by a company called Allergan, and it has what's called Y-cross technology. It will last it allegedly lasts 2 years, but the way we place it will actually last somewhat longer.
Oh, okay.
Because we go right to the bone, we get the filler under the muscle.
All right.
Right, with just a little speck of anesthetic, one here and one here, and that's all we need.
Oh, all right.
For the lower face and the neck, what we're going to do is we're going to use threads. So threads are PDO or polydiaxone sutures. They've been used in pediatric surgery, they've been used in heart surgery for 40, 50 years, a very long time. We have them made with either a cannula, which is a flat edge needle, and again, we make a little nick in the skin here, and we get the thread under the skin, and we get it down to the point where we want it to be, and it actually has little tiny, almost like a fishing
barbs.
on it. Yeah, little barbs.
Yeah.
They're barbs, but they're not. It's not metal.
Right. No.
Right.
No. Yeah.
And it'll
grips
pull.
it. Right.
It'll pull the skin all the way up.
Okay.
Like that. Okay. Now these are now absorbable sutures. So these will absorb. They will actually dissolve and go away.
Oh, okay.
It'll last. The sutures themselves will last about 6 months.
Okay.
But what happens is it makes a little micro irritation. You won't notice it. But what it does is the micro irritations cause the skin to form new collagen. And so we get a new collagen matrix, we get an increase in skin thickness, and these will hold for probably 2 to 3 years also.
Okay.
And again, everybody's a little bit different. Some will only last a year, some will last 3 years, but on average, 2 to 3 years is what we
and
expect.
It's far less expensive than
Far less
plastic surgery.
Yes.
Okay.
And again, no anesthetic.
Right.
Really. I mean, little tiny nicks of Novocaine. Less than probably 1 milliliter, which is about that much for the whole procedure.
Oh, okay. So how long? I mean, there's obviously a little bit of bruising.
There's some. It depends, and it depends on whether you're on blood thinners, if you're a bruiser to begin with.
Okay.
So the blood thinners that we want you to kind of stay off of for a few days are any type of aspirin, Advils, those kinds of things. Vitamin E, ginkgo, fish oil.
Those are all.
Yeah, those are all blood thinners. That's how they work, actually.
Oh, we didn't know that.
Now you know
Learn
that.
something else.
Yeah.
So what's like the recovery time?
The recovery time is usually about a day. It's really pretty quickly. Yeah,
Okay.
you may have a little bit of swelling, but usually, that day or the next day, you're ready to go out.
And anyone who thinks that they're not going to have some type of bruising or swelling has never been hit in their face by their brother.
Or with a volleyball.
That's right. So, because when you plastic surgery, oh my goodness, I have friends that have had plastic surgery and it's like they were in a car accident.
Yeah, for weeks and weeks.
Oh my gosh. And then they try to not let anyone know that they had plastic surgery. That's what cracks me up. So this, you could actually go away, take a week off or whatever, and come back and no one even know.
Absolutely.
Actually, I have clients that they'd say, I have to whatever, and they come back and I'm like, okay, you look better. What'd you have done? You don't say that, but they did.
You left one thing out though.
What did I leave out?
You didn't talk about the PRP or the vampire facelift. Remember?
Oh
that?
yes,
You
yeah.
forgot about
vampire,
that.
Yes.
You almost got away without.
I did.
Okay.
If you don't know what the vampire facelift is, our website has a lot of information about it. But explain.
So, the vampire, what that is that what we do is we take your blood and we extract the platelets, which have growth factors in them. So it rejuvenates the blood vessels, the skin, the nerve tissue, even fat, and what it does is it gives us a whole new look, especially on the surface. So pores, discolorations, those kinds of things. So when we combine all of these procedures together, which admittedly is a lot, and quite frankly, I like to do that. And if we're going to do all of them, we're going to do them in 2 or 3 sessions. We're not going to do them all at once. Okay. Because we're like an artist, so we want to see how our procedures are laying out.
Sure.
So we'll do this over 2 to 3 weeks, 2 to 4 weeks. Okay. But so the PRP or the platelet-rich plasma, when we'll inject that over all of the other procedures that we've done, and what that'll do is that'll layer out the skin, and you should have a nice shine to your skin.
Okay.
Should turn the clock back about 10 to 15 years.
Wow.
Really.
So
between all of them, between the Botox, between the Y-lift, and the threads, and the PRP, we get a really nice look. Minimal anesthesia, minimal downtime.
Oh wow, that's great. Wow.
There you have it.
Might as well have it done. So, all right, everybody, we have to call it. We're out of time here today, but that was interesting to me. That really the procedure of putting it all together. Of course, they could do just one.
We can do just one.
When you have your consultation and you talk to them, you figure out what they want to do.
Right, and we can do one and see where we're at.
That's true. I never thought about that. Yes.
Yeah. There's no obligation really to have it all done.
Yeah.
And we frequently do that. Sort of like painting the ceiling. Once you start painting the ceiling, then we gotta fix the rest of it.
Because people are scared sometimes, like, oh my God, I don't want to get surgery, plastic surgery, because I've seen Barry Manilow, I've seen all these different people whose faces are just a mess. And this is something, if you did it like this, you could see I want a little bit more, and you do the next part, right? That's kind of what you're saying. So that's a much smarter way to go. Plus, it doesn't hurt.
Yes.
Right?
Right.
All right, everybody, we have to get out of here. So I hope you guys enjoyed this. And if you want more information, please be sure to contact Dr. Bill. His phone number will be below. Or you can just type in drclearfield.net and you get the website. So, everybody, have a wonderful, wonderful day. And as always, be a good human.